So, if we had to look at girls or females with polycystic ovarian syndrome, it's something that we're seeing more frequently these days. What is your approach, and do you find that our lifestyle impacts?
It's not just gynecological disorder. There can be metabolic disturbance that does not allow the ovaries to function properly. So ovaries are producing more of androgens, the male hormones, and that is why you've seen many patients. They are like having acne, unwanted hair growth, hair loss, and inability to lose weight.
People fail to realize that we are what we eat. So everything we put in has a consequence.
Yes.
And a lot of times you try to do extreme diets and you want a quick result, and guaranteed you will lose weight. But how much of a lifestyle change have you made, and is it sustainable? So a lot of the times we need to do things that are sustainable, that we can do for the rest of our lives. When you are, example, eating healthy, it shouldn't be that I have to eat healthy and I have to avoid certain foods. It should be that I want to, because I want what's best for me. Hello and welcome to Autosports Podcast. We are here today to deliver you health, wellness, and fitness advice. Today we're going to be focusing on women's health. And in studio today, we have Dr. Vandana Pal, a qualified obstetrician and gynecologist with over 20 years experience, and she offers comprehensive health care to patients with fibroids, PCOS, fertility issues, as well as high-risk pregnancies. She has had extensive training at the University of Kiel in Germany. And Dr. Vandana, it's an absolute honor and pleasure to have you here with us today.
Good morning, Rochelle, and thank you so much for having me today here. And it's an honor to be presenting the issues regarding the women health. And Dr. Rochelle, you are just a very vibrant general practitioner doctor with us in orthosports with 8 years of experience, specializes in diagnosing and managing chronic health conditions, and is certified in mental health care management with a special interest in OBS and Gynae from the university in South Africa.
Yes.
Thank you.
Thank you. So let's talk about women's health today. If we had to look at gynecology and look at the different phases of a female's life, we have about 4 different stages that we go through, from adolescence, being in the puberty stage, then moving on to reproductive stages of life where we're now family planning. We then have the midlife stage where we're going through menopause, and then lastly, our postmenopausal stage. Can you walk us through these different stages of life and some of the common presenting problems that patients may encounter during these phases?
See, Rochelle, women's health is a very broad and a very vital topic,
Yes.
because it has many aspects. It encompasses from physical, social, mental well being,
Yes.
and from reproductive health to mental health, from nutrition to disease prevention. And as a woman, we face many unique health challenges.
Yes.
And the biggest challenge nowadays, which I think many people approach to me, and a shift I have seen over the years, over last 20 years, like people used to come to me when I was young and they were in their early 20s, planning a pregnancy, starting a family. Now there's a shift, people are like in their late 30s and even early 40s. So, Rochelle, because it's a very broad and a vital topic, and whenever we are approached as a gynec by a woman, I need to categorize them, because categorizing according to their age is very important. Why? Because some of the symptoms with which they are approaching me at a particular age, the differential diagnosis in my mind will be different. For example, if a 20-year-old or a 25-year-old is approaching me for a spotting per vaginum or some irregular bleeding, so the differential diagnosis will be different for me. I have to rule out pregnancy in that case. But if the similar problem a 60-year-old is approaching, the differential diagnosis changes altogether. So categorizing a patient into different age group is very important, be it adolescent, reproductive, perimenopausal, menopausal, and postmenopausal, because different common problems can be there in all the age groups. And the good rule of thumb is that if any reproductive age group 20 to 45, I have to rule out pregnancy in them.
And that's something important, because if you had to look at an older person that's 60, or postmenopausal, and they are presenting with bleeding, sometimes they may think that, oh, it's normal, but it's so not normal for an elder woman that's postmenopausal to have bleeding. So when you have this patient that presents to you with bleeding, what are the important things to rule out?
See, the foremost thing is I would like to know like how many years they are into this menopause now.
Yes.
Because most of the times, if it is like menopausal 60 years old, I
Yes.
would rather think of some cancerous
Cancer.
condition, endometrial cancer, cervical cancer.
Yes.
So that is the difference of dealing with different age groups during your when they approach you.
Of course. Something that I see more recently is that if you had to look at the past, a lot of people were planning their families very early on in life. Whereas now we have a lot more career orientated people, and they are actually achieving their goals first before they start family planning. And we're now looking at a lot of people planning their families after 30 years of age. But as a female, it's always something that's a worry at the back of our minds. We have a biological clock that's ticking. So, when is it a good time? When is it too risky? And how would a female know that they are no longer fertile? These are common things that females often worry about as they get older. So, can you enlighten us about the best predictor that a female can use when it comes to fertility?
Rochelle, I do agree there is a huge shift from 20s to 30s and early 40s. People, the women, they are very much career oriented. They
Yes.
want to have their stronghold in their life, and then they want to plan a pregnancy, which is again a good thing, planning a pregnancy, a healthier pregnancy, because if you plan something new, it is going to have a lifestyle change.
Yes.
And also knowing that what lifestyle changes they need to have a healthier outcome is very important.
Yes.
And the best predictor, for if you ask
Mm.
me, is the age. We are born with fixed number of eggs.
Yes.
Yes. And as the age increases, the number of eggs decreases. So it is not only about the quantity, the
Yes.
quality
Quality.
also.
Of
you know
course.
as the age increases, there are more chances for having spontaneous miscarriages, having pregnancy with chromosomal abnormalities. So with the recent advances, if you are planning, like you want to delay or defer your motherhood, and in that cases we have like oocyte preservation
Mhm.
and even the variant tissue preservation,
Mhm.
but they do have their social
Yes.
and moral responsibilities. But
Yes.
yes, we can check their fertility levels by doing the anti-Mullerian hormone AMH level, AFC, antral follicular count. But I have seen people with low MH also having good pregnancy. So the age is the best predictor,
Of course.
and you have to plan accordingly.
So that's why I think preconceptual advice is so important. If someone wants to start a family, they need to know the do's and don'ts. They
Yes.
need to know, what vitamins should I take? What are some of my risks involved? Family history is something very important. You got to identify that high risk patient. So any person that is wanting to start a family, they should see their gynae and get preconceptual advice first.
Yes, because that's important to have a planned pregnancy, as I
Yes.
earlier said. Because why planning is important, they need to make some lifestyle changes. Maybe
Yes.
there are weight issues, maybe they have a family history of diabetes,
Yes.
hypertension.
Or they're on
So,
medication.
yes, they are on some medication. So, they need to see a gynec, they need to see a OBGYN who can guide them through their journey of this motherhood.
Yes.
So, that is very important because if for example, the weight are the issues. Even if you're overweight or underweight, you are, I'm not saying that you might get, but there are risk factors associated with it. Like if you're overweight, you are, obstetric complications can occur like GDM, hypertension. If you're underweight, there can be fetal growth restriction. So in that way, if you're planning, it's better that you take your prenatal vitamins and you get your lifestyle changed if you're having any kind of difficulty in that. That is what we are like coming to
I agree
fill the shoe.
totally.
Yes.
So, Dr. Vandana, a lot of females approach me and they're using apps to track their fertile window. And they tend to check when they're ovulating and then plan conception around ovulation or their fertile window to be more successful. How accurate is this method?
See, menstruation has a symbolic meaning in different cultures. You know, there are many attitudes and beliefs surrounding menstruation. And I think so it runs down from mother to daughter.
Yes.
So that is why some of the females, they have this thing in mind, like what they are like, they have heard around and they have been told to have certain fixed days when they have contact with husband or partner to get pregnant, like, so, and they follow some kind of apps.
Yes.
But yes, it can be true in some of the cases when you're having regular cycles, so ovulation can be predicted. But if there is some irregularity there, it is not very predictable to follow those apps. So you know, when you are actually trying to get pregnant, it is the frequency of contact which has to be increased. It is not just covering those particular days.
Yes.
That is the advice I would like to give.
So I think again takes you back to the preconceptual advice.
Yes,
Because
that's all we, that's an opportunity,
Yes.
you know, whenever a female approaches, I think so that's a very very good opportunity to make them aware, to educate them about their myths, their beliefs, you know. You can talk to them at length because they are still planning to get hold of the things, you know. So that is why I think so any female, whether preconceptionally she's approaching you or any kind of problem she's having and she's approaching you, I think that's a great opportunity for me to counsel my patients. That is the way I deal with my patients.
So, if we had to look at girls or females with polycystic ovarian syndrome, it's something that we're seeing more frequently these days. And a lot of patients come to me with weight gain, irregular periods, or acne, unwanted facial hair, hair loss. And they often have a lot of metabolic complications like insulin resistance and later on in life, diabetes or hypertension. With these patients that have polycystic ovarian syndrome, what is your approach? And do you find that our lifestyle impacts the
Yes.
syndrome?
See, our knowledge of PCOS has evolved over the past few decades, you know. Earlier, we used to think that the master gland, the pituitary gland, is the culprit. But now, after so many studies have come and then we have seen, and you know, it's not just gynecological disorder, it is an endocrinological disorder. There can be metabolic disturbance. And over the years, we have seen that insulin resistance, the carbohydrate metabolism, is also one of the etiologies behind the females having this problem, because that does not allow the ovaries to function properly. So ovaries are producing more of androgens, the male hormones, and that is why you've seen many patients, they are like having acne, unwanted hair growth, hair loss, and inability to lose weight, you know. And all these factors, when they are playing inside the body, it kind of makes a vicious cycle, you know. And unless and until you break this vicious cycle, you are just going round from one thing to the another. And you rightly said that patients are at risk for developing diabetes in later on life. So I think so here the role comes of a holistic approach to deal with certain set of problems like PCOS. And the main thing here is lifestyle change. And what I tell my patients, that you have to eat healthier consciously healthy diet.
Yes.
And it is not just for 2-3 months, it has to be consistent. It has to be a ongoing thing with you, and you need to incorporate some kind of physical activity into your daily routine, to begin with. If you think that, okay, I'll join gym, I want to lose weight, I think so that misconception of losing weight, no, it should be like, I would rather advise them to be healthy, fit, they can go for 10 minutes of walk after each meal. Once they are doing this, they get this motivation,
Yes.
and then this becomes a regular, they become conditioned, they become habitual, that
Yes.
at conscious level, that they have to eat healthy. So that is the main thing, that is the main goal.
I find that exactly what you said, so many patients are focusing on just losing the weight, and they're going to do extreme forms of dieting, intermittent fasting, some even starve themselves the whole day, and they then try to join a gym and they do things that are quite extreme just to lose that weight initially. Some of them even consult for, weight loss medication.
And Rochelle, even if you reduce the 10% of your weight,
Yes.
you see the difference, and that's a motivation
Of
enough.
course, but it is a lifestyle change.
Yes.
And a lot of times you try to do extreme diets and you want a quick result, and guaranteed you will lose weight.
Yes.
But how much of a lifestyle change have you made, and is it sustainable? So, a lot of the times we need to do things that are sustainable, that we can do for the rest of our lives. When we are exercising, it shouldn't be that I have to exercise. It should be I want to exercise,
Yes,
because it's a
exactly.
lifestyle change. When you are, example, eating healthy, it shouldn't be that I have to eat healthy and I have to avoid certain foods. It should be that I want to, because I want what's best for me. And people fail to realize that we are what we eat. So everything we put in has a consequence.
Yes, definitely.
I read a study recently that showed there was a direct relationship between a sedentary lifestyle and the metabolic risks that patients that were infertile with PCOS actually had. So, if we are seeing sedentary lifestyles, unhealthy diets, and a direct impact to metabolic risks in PCOS patients, and that's something quite significant. And that's a huge wake up call for every person to lead a healthier lifestyle.
Yes, definitely.
Can you enlighten us if someone's at home and they feel like they have these symptoms of polycystic ovarian syndrome that we have spoken about, and they see you as a gynae? What factors do we look at in order to make that diagnosis?
So, see, there are many factors which we have to look into before we diagnose that this is a PCOS. One of is the Rotterdam's criteria, in
Mhm.
which we have the appearance on ultrasound, we see the PCOS ovaries. And the another one is diagnosing it with the blood test, looking at the androgen levels, and also the FSH and LH levels, doing the insulin and fasting blood sugar and insulin levels. So all these things help us to diagnose, and also the history, they coming with the irregular cycles or no cycles, which means they are anovulatory thing there. So all these things are running in a cyclical manner. It is basically the interaction between the pelvic anatomy and the brain. So that has to be synchronized, and that synchrony can come through lifestyle changes and healthy eating.
So, Dr. Vandana, can you enlighten us about some of the symptoms that patients with menopause have? I've always heard patients come into my room and they're very frustrated with the symptoms of menopause, the hot flushes, irritability. Can you expand on some of the symptoms that a menopausal woman could face?
Uh, Rochelle, you have picked up a very, very interesting topic. You know why? Because 40% of women, they spend their lives in menopause,
Mm-hmm.
because, and that is the time when they feel as if they have lost something very
Yes.
important, very crucial. And there's and also there's lack of awareness
Yes.
surrounding this menopausal symptoms. But if you ask me, that I tell you, like, any universal kind of symptom, there are none, because it's very different for different individuals.
Mm-hmm.
Some of the 80% of the females, yes, they do get hot flushes and night sweats, which can lead to insomnia, okay, brain fogging, anxiety, depression, and menopause is one thing when the females start thinking as if they are of no use anymore. Why? Because they think they have lost something.
Yes.
And I think so, as a gynec, we should be having more empathy towards them, listening to them, making them aware of their symptoms. Because it's not just after the menopause they are going to have this. It's a transition process which starts much earlier. Sometimes during their like routine activities, they are carrying out so many things now. I've already talked earlier, like the shift is there, like early 40s, the people are coming for like
Yes.
planning pregnancy, and then they have this whole set of planning pregnancy, giving birth, and then the project starts of picking up, dropping children, homeworks, managing personal and professional life, and slowly and gradually they are transitioning, they are aging, they are going towards that phase, but they don't realize they are having these symptoms earlier as well, but they do not like actually giving thought to them. So I think so that there comes the role of us as a gynac, that
Yes.
we should make them aware that these are the things which can come early on.
Yes.
It is not just post menopause. So these things are important, and yes, it can be managed. There are few tips which they can, like having lifestyle changes. We have already talked about
Yes.
this, okay. Meditation,
Of
relaxation
course.
therapies, and healthy eating,
Of
and
course.
also exercise. You
Yes.
can incorporate any kind of physical exercise, like you can start with walk, mild jogging, and you should include some kind of resistance exercises in
Definitely.
your daily activity.
Yes.
It can be, you can use resistance band, light weights. You know why? Because it increases your muscle mass,
Of
because you're
course.
losing estrogen.
Yes.
So, and you're losing your healthy hormone, which is taking care of your heart health, your bone health.
Of
And you
course.
can take the supplements like calcium and vitamin D. But before starting anything, I think so you must visit a gynec,
Definitely.
discussing and talking about your problems, what you are going through. Because what I feel, if you talk more, you suffer less.
Yes, definitely. I agree totally. And this, we have so much of amazing technology today. Patients can come in for a consultation, you can do their blood test, check their vitamin D, their calcium levels, send them for bone mineral density
Yes,
scans
yes,
to
definitely.
monitor if they're osteopenic or osteoporotic.
And also that is a good time to screen them,
Yes,
for their, because screening tests for cancers, it's really important.
of
Because
course.
as you turn 40, I think so you should have a screening test, get your mammograms done, get your
Yes,
paps done, and you should be like, and also it's a good time to know what is going on in their lives, and you can make a big difference. Because what I think, in spite of our sciences doing so many advances these
mm,
days, but despite all these things, there is a significant disparity, with maybe it's lack of awareness or the accessibility to these things, which has made things little challenging for the women, and
yes,
that is why I think we should be talking more, making them aware. It is not just talking, it is about action as well.
Of course, I agree totally. So, the World Health Organization recommends at least 30 minutes of cardiovascular exercise 5 days a week. And now, if you're looking at the older population, they may have this misconception that they need to join a gym or they need to do, high intensity training. It's not that. We understand that as you get older, there may be osteoarthritis settling in or their bones and muscles are weaker. So even like you mentioned, just brisk walking is
Yes,
sufficient.
they can go for yoga, they can go for
Yes.
meditation,
Swimming,
swimming, and they can indulge in some kind of mental exercises
of
as well,
course.
because the Alzheimer's, it is the leading disease nowadays,
Yes.
so they can indulge themselves in any kind of mental activity.
There has to
So
be, right? Our
yes,
mental health
and they can join
affects.
some groups,
Yes.
keeping themselves busy.
Of
So
course.
because what I have seen, once you are menopause, they think that their receptivity is they're losing their receptivity. There is sometimes loss of memory, and that is why
Mm.
they try to stay indoors, because they feel that maybe they are embarrassed, they are like they can be questioned. So that is why I think so everything zeroes down to the holistic approach for the
Yes.
healthy mind, body, and
Yes.
soul. That's what
Because your
I think.
mental health affects your
It's
physical health.
yes,
And remember, this is also a population where a lot of patients in this age group are retired.
yes,
So their social life has been greatly reduced, and that impacts on their mental health. So example, if you're going to be sitting at home in front of the TV all day and you're not socializing, that does impact.
correct.
So doing things like crossword puzzles, keeping your mind constantly active, that's extremely important.
Yes,
Talking back to cancer screening, and I think that's something so important. And I find that a lot of patients are very shy to talk about cancer screening, or maybe they're not fully aware of the importance. The common thing that I get is that I'm well, doctor. Why do I need? I have no symptoms. Why do I need to test for cancer? Or they are extremely scared and they have this perception that it's something very painful or uncomfortable. We have cancer screening tests that are available to us. And the reason why we call it a screening test is that you are well, you have no symptoms, but we are doing these tests to identify our high risk population. Those patients with abnormal cells or precursor cells, that if we find something abnormal, we can intervene at an early stage and prevent it from turning into cancer. So, for the patient that has symptoms, that's different, right? It's
yes, that will be
diagnostic.
diagnostic.
But now we have a patient that's well, and we want to make sure that they are
That's what
well.
the screening tests are for, that before even
Exactly.
you have that bad cells in your
Symptom.
body, you are getting
Yes,
screened, and if at all it's there, you can treat it then and there.
of course.
It's treatable. But the back of the mind, they think that your doctor is suggesting you to go for paps or for mammogram,
Why?
as if yes,
Is there
do
something
do I
wrong?
have the cancer?
Yes.
So it's again, it's like making them aware of their things, that this is treatable if you get the screening test done at the right
Early,
time,
of
early.
course.
So what I tell my patients, that age 21 onwards you can
Hmm.
go for the pap smear, and 30 onwards you can go for paps plus human papilloma virus, which is the deadly
Yes.
virus which causes
Yes.
cancer. Because many a times we have seen that 80% of the times, even if you are infected with human papilloma virus,
Hmm.
it is cleared from the body if your defense mechanism, your immunity is strong enough. It takes time to clear up,
Yes.
12 to 18 months, but it does get cleared. But in some cases it may stay latent and it comes later on in life,
Of
and
course.
there this screening methods which we have
Yes.
plays a big role.
Huge.
So we can treat them, and it has definitely reduced the maternal mortality rate.
Yes.
And the same with the mammograms. One should get their mammograms from the age 40 to 49. They can go
Hmm.
for annual mammogram, and once you cross 50 to 74, you can go for 2 yearly, you can interval with 2 year interval, you can have your mammograms. They are really, really important.
Yes.
You know,
And
they're.
again, it comes down to education, right? So, example, you don't just also wait for that mammogram to get done.
And I forgot to mention the human papilloma virus vaccination, the Gardasil. I
Yes.
think so. This is a good opportunity,
Yes, of
to talk
course.
about Gardasil. So we have a Gardasil 9 now, so which takes care of the HPV viruses, which can cause vulval, vaginal, cervical, oropharyngeal cancers. But again, vaccination gives you 99.9% protection,
Protection,
but you cannot forego the screening
of
because
course.
there are other HPV viruses which
Yes.
can cause cervical cancer.
Yes.
So the screening process, the screening tests, they are mandatory, and one should get it done.
Definitely. So, like you've mentioned, just for the viewers at home, if you have an HPV infection, that increases your risk of cancers. And how many of us have actually checked?
I think so. We should. That's a call for
Yes,
everyone
of
to
course,
visit their gynecs and get themselves checked for
because
the HPV infection.
it makes you more vigilant and
Yes.
it allows your gynae to
And
intervene much
it's and
earlier.
yes, it's treatable, if you have infection, it's treatable. You can, but there is no oral treatment for that. But
Yes.
yes, you if you are on the, like, you are put on a regular screening schedule, so it can be, if at all you are going in for some kind of bad cells or
Hmm.
atypical cells are there, you can go for further diagnostics.
So, with the Gardasil vaccination, what age groups can take Gardasil?
So it can be taken by both boys and girls between 9 to 15, and between 9 to 15 it's 2 doses, and
Okay.
beyond 15 to 45 it's 3.
So, Dr. Vandana, just as a recap, if a patient has a pap smear and we find that they have abnormal cells, that's something worrying. Okay. What can be done when we find out that this patient has precursor cells?
Okay, so if you have some kind of atypical cells or malignant cells, you can go for colposcopy. And on colposcopy, if further the colposcopists think that you need a colposcopy guided biopsy, you need to
Hmm.
go for the cervical biopsy and then look for the kind of malignant transformation, the malignant cells there, what stage is that, and then from there the treatment can be done.
Okay, Dr. Vandana, if we have a patient that has now found out that they have a positive pregnancy test, it's an extremely exciting time for that couple to know that they are going to have a baby, but they're also anxious because now they don't know what to do. When do they get a scan done? When is it an appropriate time to actually find a heartbeat on a scan? What blood tests do they need to do? How often do they need scans? Can you just enlighten us about the journey that a pregnant patient walks through?
Okay, Rochelle, that's a nice question, because whenever a patient comes to me, they have already done a self urine pregnancy test at
Yes.
home, and they say, "Doctor, see, we have two strong lines." And I'm like, "Okay, congratulations." And then they are like, "Doctor, can you show us the baby?" So I'm like, "Okay, I need to calculate now, like what the period of gestation is." So
Yes.
I tell my patients, like, sometimes they are walking in at 6 weeks or even at 5 weeks, so I tell them that this is not the exact time that I can, sometimes I can show you the baby, but sometimes if they are really, really anxious to just see the heartbeat, so I tell my patients that just wait for 2 weeks more, like 7 to 9 weeks is
Yeah.
the time when we can actually pick up the fetal cardiac activity.
Mhm.
And then you asked about what all scans should be done during this entire journey. So, one very important scan, so we divide it into trimester wise, first,
Mhm.
second, and third. So, first trimester scan at like from 11 to 13 plus 6 weeks. It's important because that time we do the NT and NB scan, that is nuchal translucency and nasal bone scan, which is very important, which is a soft tissue marker for the Down's baby, and then which is followed by the double marker. And then during the second trimester, we go for the anomaly scan, which is done at the fifth month completion, that is 20 to 22 weeks. And then the growth scan comes, which is done between 30 to 32 weeks. Okay. And all these scans are mandatory, because many a times, even if the pregnancy is going, the antenatal care they're receiving, everything is going normal, but sometimes some of the risk factors they come later on.
Yes.
Sometimes there can be a family history of diabetes which appears later in the pregnancy, because pregnancy in itself is a physical and a mental stress for the female. So sometimes these complications can be later on. So as and when required, it is not just that we just do these 3 scans. As and when required, we can go for more scans in these patients.
And what blood tests are usually
So,
important?
yes, you should be knowing your blood group, the amount of hemoglobin, because if you are anemic, again, you have so many complications, obstetric complications, fetal complications present with that.
Mm.
So, a good amount of hemoglobin, blood group, sugar levels,
Mm.
urine infection should be ruled out, your thyroid levels, your rubella status, and any sexually transmitted diseases, your viral markers. So, all these tests, I think so, if done at an appropriate time, will give you a very smooth and healthier outcome and a
Definitely.
healthy baby.
I agree. So, in closing, Dr. Vandana, it's been amazing chatting with you and talking about women's health. I think we've covered a lot and hopefully a lot more in the future. Are there any closing statements from you?
I think so. Each step, even if it is small, it will lead to a brighter and healthier future. As rightly said, that you may not control all the events that happen to you,
Mm,
but you can choose not to be reduced by them. So I
definitely.
think so. It's all. And Rochelle, you and me, as a healthcare provider, we
Yes.
together can make a
Oh,
difference.
I agree 100%.
Yes.
And I think also the take home message is that prevention is better than
Yeah.
cure.
Yes.
So, consulting with your healthcare practitioner is extremely important if you want correct, accurate information, because we're always going to do what's best for you. Thank you so
Thank
much,
you,
Dr.
Rochelle, for
Vandana.
having me today.
So,
Thank you.
don't forget to subscribe to our channel. And if you enjoyed this video, click like. And if you have any questions for us as doctors, please, you can post your question in the question tab below. If you're interested in booking an appointment, please press on the link below and we will gladly assist you.